Well, you can't really have a thorough review process that the public requires that is done in a hurry because then it's not thorough. So an application like Pfizer's involves over 100,000 pages. That takes time to read it. So if you want to do that thoroughly, it's going to take time. Also, FDA lost a lot of employees in 2020 under the conditions they had to work in the Trump administration and the political pressures they were being put under. A lot of mid to high level staff left. It's been difficult to replace them. It's difficult to replace the expertise. FDA also has at the same time to review other vaccine programs in the COVID area. So it's reviewing the childhood vaccine programs, the 6 to 12-year-olds. That's in the same uh, people having to do the same kind of review process. It's reviewing Moderna data, it's reviewing J&J data, it's reviewing Novavax data, and so at some point you just run out of trained personnel and hours in the day. So yes, it takes a long time, but if it didn't take a long time, the public couldn't have any confidence that it was being done properly. So that is what it is. And now we have a full approval, and that's beneficial because there is a subset of people in the public who have said that this matters to them. They have the perception that emergency use authorization was rushed and didn't capture enough safety data. To people like me who have a better understanding of the process, that's not a big deal. That's a distinction without a difference. We were happy with what we saw last year. But clearly, to some Americans, they want to see the full approval, and they now have it. And it also matters to some employers who are more legally confident and morally confident in applying the vaccine mandates that are now unfortunately necessary to help increase vaccine uptake rates. And already this morning we've seen New York State put in mandates for teachers, which is exactly appropriate, entirely the right decision. And we've seen the Department of Defense do so for military personnel. And again, these are necessary. It shouldn't have been necessary, but unfortunately, given that there's still 70 to 100 million Americans not taking the vaccines, it is necessary. Well, it's working on the Moderna application, which I think is about a month behind in time terms. So one would expect if the same procedures are being done by the same people in the same kind of timeline, that could come in a month or so, one would hope. It is important to get the childhood 6 to 12-year-old approvals done, and that's going to matter for school-age children. The sooner the better. But again, if they're rushed or seen to be rushed or thought to be rushed, that becomes counterproductive. They need to be seen to be thorough and as quickly as possible. Very. It's been well over a year's worth of experience now. When you go back to human trials, it's very effective. It has remarkably few side effects of a serious nature by historic standards. Sure, people get sore arms and some people get a bad day, but that's a small price to pay because you get a lot worse day if you get COVID. So these are all life-saving technologies, and more and more people should be embracing them so that their lives are in fact saved and the people around them are saved as well. Well, Delta remains the priority at the moment. Let's deal with what we know. And we know that 2 doses of the mRNA vaccines are sufficient to keep almost everybody out of the hospital and the morgue, which is the priority. There are more infections happening with Delta in the 2 dose vaccine regimen over time. But those infections of vaccinated people are almost always of the at-home cough, cold, sneeze, snuffles, sore throat for a few days to a week. They're mild COVID, which is not ideal, but isn't the end of the world compared to the consequences when you're not vaccinated, which a very significant chance of being seriously ill and dying. So the vaccines are still working. The authorization or the recommendation at this stage from September the 20th that Americans get a third dose. And that again is conditional on FDA reviewing the process, which is yet more work for the FDA. So if FDA and CDC sign off on those and the full process starts on the 20th of September, then people who are most in need, which is the elderly, healthcare workers, nursing home employees, people who are most in contact with vulnerable people or are at risk themselves, that rollout will ramp up. Already, a lot of people are doing it anyway. They're finding a way to get dose 3 anyway. We all know this. But when it starts officially, it will kick into high gear. And that will provide additional protection. It's not that you don't have any protection now, it will give additional protection. And that, of course, will help deal with other variants. At the moment, other variants, they're on the radar screen. They're not being ignored. It's possible that we could finish up with worse than Delta. Certainly, you can't say we would never finish up with worse than Delta, but let's deal with Delta because that's what's around at the moment. Well, the FDA truly does have a lot on its plate. I mean, it is a government agency. People who work for government agencies earn a lot less than people in the private sector in general terms. I mean, it's not a great job in dealing with this amount of material under this amount of pressure. I think we all need to be extremely grateful to the employees who have been working so hard on all of these approval processes. And you can't expect miracles. They've done an amazing job, but it does take time. But now, with full approval, the number of excuses for people not getting vaccinated is falling by the day. And unfortunately, with still best part of 100 million Americans unvaccinated, there are a lot of people walking around today who are going to be dead by Christmas. And that's really very unfortunate. There's maybe as many as 200,000 Americans who are just the walking dead right now. And that's so avoidable because they would save their lives and the risk to their loved ones and co-workers if they just went out and stuck their arms out and get these highly safe and very effective vaccines.